Hi, and welcome to the new normal. I'm Sharon Weinstein, CEO of SMW Group and founder of the Global Education Development Institute. It's been my pleasure and privilege over the past several months to work with my colleagues at D2 in support of many of your initiatives. I'm really pleased to be invited to share the new normal with you today. Let me share my screen. The new normal. Is it new or is it next? No one may ever know. So we have multiple challenges that we face in terms of impact, funding, media, fear and anxiety, and of course our families. How long will it take us to return post-pandemic, or will the new normal or the current normal change the way in which we do business? What lessons have we learned from COVID-19 that will alter relationship building, networking, and perhaps entrepreneurship? In this session, we'll share lessons learned, possible changes in our business models, and recovery plans. We'll talk about the impact, the funding, the media, the fear and anxiety, and of course, our families. So let's face it, the impact has been significant. The coronavirus has also brought major changes to construction's back offices. Forced to stay at home, many office employees have kept business operations running as usual, business as usual, but via remote work, relying on technology like video conferencing and emailing and texting to remain in touch. This nationwide experiment in telework will likely cause many leaders to think about making this practice permanent. A recent study found that 74% of American companies will move at least 5% of their office workforces to a remote environment. And in some cases, over 20% of employees may be working remotely. So from inventory and supply chain and all kinds of other issues, we have concerns. Even before the outbreak hit the United States, the coronavirus created major supply global disruptions, especially with goods from China, the source of about 30% of U.S. building materials last year. Government containment efforts and quarantines in China slowed or shut down deliveries, leading to a fallout in production of everything from cars to smartphones. And U.S. builders like yourselves have noted delays and shortages in items like steel, surfacing, and case goods. Funding is an issue. It's expensive to maintain a more safe than ever environment, to provide the kinds of protective gear that we all need in order to be safe and to work in a safe environment. So protection of work sites and workers has always been expensive, but now more than ever before. Think about the gear, the work schedules, the expanded hours, and how this has impacted you and your team. The virus put a spotlight on the importance of worker health and safety, and U.S. contractors responded by implementing new job site policies like staggered shifts, employee temperature checks, top-to-bottom disinfection of job sites, tools, and machinery. But how easy is it to disinfect a work site when you're working out in the public, out in space, digging the foundations for future buildings? A gust of wind or anything else can totally disrupt what was once clean and disinfected and make it reinfected. By improving standards to protect our most important assets, our people, we can grab the bull by the horn and we can revolutionize ourselves, coming out of the other end more efficient with safer, healthier job sites. And media, of course, has played an important role. Sometimes I think that it's really important to take a break, a media break, because of the doom and gloom involved and the negative messaging. We really need to think more positive thoughts. Throughout the country, we've seen reopenings. We have also seen places that have reopened now reclosing. Perhaps they opened too soon because there was too much in terms of people and too little in terms of distancing. More than ever, we have to focus on prevention. Let's use leading indicators to focus on what we're doing right. Let's give our field teams the ability to record near misses, to report on unsafe practices without a fear of repercussion. Let's make informed decisions that lead to improvements overall. And let's provide proper facilities to support better hygiene and reduce the possibility of future virus transmission or sickness resulting from inadequate facilities. Safety is a concern, extended project delivery times are concerned, and it is no longer business as usual. Fear and anxiety set in. When the pandemic first hit, two approaches to construction work emerged. In one area, in the New England states, construction work was suspended indefinitely. In other places like California or areas where it's favorable from a weather standpoint to work all year and at all hours, work continued as usual. As a matter of fact, in some places, they accelerated project timelines with fewer cars on the road. For the first 2 months of the public health crisis, the construction industry lacked clear direction on the requirements of a safe and healthy construction site. Now, however, more companies are moving forward, are being reinforced with state and local authority regulations and with the requirements of safe construction in the time of COVID-19. We are seeing change, and we're fortunate to have that happen. Families are a concern. Our families have been overwhelmed with the changes that have taken place. The need to follow safe practices by disrobing from our work clothing and showering before hugs, kisses, and interaction with family members. Homeschooling or school at home has created change with more family members in place than ever before. How many of us have large enough homes to allow all family members to distance and still be connected? College students have returned and may not return to campuses across the community or even across the country. Training has become virtual. What was once a periodic virtual program has become the gold standard and commonplace. The law of disruption, addressing technology, change, and safety. There are so many issues related to these three factors. Technology has changed the way in which we communicate and the frequency with which we communicate. The phone no longer weighs a ton. We pick it up more often and have conversations with people with whom we might previously have only interchanged via email. Change has taken place in our workplace and in our workforce, and safety is, of course, the primary concern. Together, though, we'll succeed. Social and physical distancing have become and will become the new norm. Whether or not people actually meet those requirements and whether they're compliant will be a totally different issue. But distancing will be the norm via technology. The current emphasis on social distancing on job sites will likely continue even after the current health threat passes. Expect to see fewer activities and defined procedures and protocols for even some of the most routine tasks. And even as the current outbreak subsides in many areas, state and local officials are putting measures in place to mitigate risk on construction sites from this time forward. New guidelines in Washington state require that job site employees stay 6 feet apart. How can you do that when you're dependent upon your peers, your team members, to be able to get a job done? This could, in fact, lead to a project shutdown. The need for social distancing has also changed how contractors interact with project teams, with consumers, with companies. And change is good, but it may be permanent. Is it new or is it next? These new regulatory standards could end up sticking around as the new normal for the industry for the foreseeable future, or they could end up requiring a complete overhaul in the near term if workers begin to encounter the kinds of outcomes currently ravaging workers in other sectors of the economy. We need to be more careful because the world of work has changed. It all starts with one. Whether it's a global pandemic or catalyzing positive change, it begins with one. Protocols to promote social distancing and employee health, including a ban on carpooling, a 100% mask and glove policy, and well-stocked hand washing stations are in place. The emphasis on cleaner, less crowded work areas is one that won't recede even after the virus does. Contractors can't be thinking that they bring workers back after all this dies down and it will be business as always, the same as it was before, because it won't. Advanced safety measures are here to stay in our world of work. But yet our business goals are unchanged. How we get there and how we continue and how we deliver will be different. We'll still deliver high quality and great value, but will construction schedules be longer? Will deliverables be the same? Will business, if we have known it for years, be the same business model that we created? and what changes will occur? How can we involve our teams in that process? Change happens. In the book, Who Moved My Cheese, the author talks about contingency plans. What will happen when we run out of cheese, or in our case, supplies, and whether or not there will be a stockpile of new cheese, perhaps in another location. Change in this environment has tested each of us. We realize that not everyone is responding to the pandemic in the same way. Tempers sometimes flare. Patience may be minimal or non-existent. We may see more conflict and difficult people with whom we must work. People who normally in other days and times were fine, but now stress has them changed in terms of personality and reaction. Like in any relationships or a good marriage, you pick your battles carefully. Surround yourself with those who bring you joy, who make you feel good about being you, and secure your future with an attitude of kindness, patience, and attention to detail. What commitment will you make based upon your own work environment and what you've learned today and through your company? Think about your commitment to your employer, your team, your association, and your industry. Be ready, but be ready for more than ever before. The Boy Scouts always had a saying, be prepared. We need to be prepared for change, ready for delivery of the best that we can possibly provide. I refer to it as a outcome. I've always discussed outcomes in the clinical setting, in hospitals and human resources, and in the world of work. If we go the extra mile, give more than is expected, look beyond the box and assume that when it does not exist, we'll be ready, we'll be prepared. So I ask you to think about that box. We often talk about thinking outside the box. If we assume that the box does not exist, we don't have to worry about those four sides. Instead, we can move on, move ahead, and deliver service, product, and outcomes with a wow. And now we'll break out into our breakout rooms. Katrina has done a good job of pre-assigning each of you. And within those rooms, you'll be using the form that you were given to talk about your concerns and your action steps. Each of us is concerned about the new normal. What are your top 3 concerns, and what responses will you take? And then from a recovery standpoint, what is your greatest challenge? How long will it take you to recover? How will you build relationships with potential clients and staff? Some of your responses may be personal and some may be professional. You'll appoint someone to share your team's results when we reconvene. We're all concerned. Please meet. Please start that process now. Now that we've returned from the breakout rooms, let's share what we learned during those sessions before we close. Welcome back, everyone.
Hello.
Hello.
Hey. Let's hear from a spokesperson for each of these groups to find out what you learned, what you discovered, and where you're going from this point on. So who was in group number 1?
I was Jeannie.
Okay. All
I'm
right.
still filling out the
team.
form, but some of the concerns that we had were allowing networking to happen in the new normal and how to do that. We didn't really come up with many of the actions on the form. We were having some issues hearing another breakout room in the background.
Okay, that's interesting to know, Katrina. Okay.
Just because there's 2 employees in the same office and they weren't in the same breakout room is why.
Okay.
Anyway, so one of our concerns was allowing networking to happen in the new normal and how to make that happen in the safest way possible. Another concern were family issues as far as it's, not whether or not a person wants to be somewhere, it's whether it's safe. In regards to thinking of, family members back at home, am I going to go somewhere and be near somebody who I may know very well and feel very safe and confident being around, but yet don't know who they've been around and could possibly,
exactly
pick up the virus or whatever. So those are like the 2 main concerns that we came up with. Again, couldn't really figure out the actions because I know for me personally, I'm I'm at a loss. I mean, I know what I can do to keep myself safe and what I can try and do at least to try and keep myself and my family safe. You know, I walk around with Clorox wipes all the time. I've got my mask, I've got hand sanitizer. I'm, you know, just constantly wiping things down, washing my hands, and, you know, distancing myself. I can only do so much as one person, you know, we all have to be doing that. All of us, not just D2, but all of us in the world needs to be doing this. And how do we educate, which is one of the steps in the recovery section, is we need to educate people. How do we educate them to be doing the right thing? Like Ike mentioned, he, you know, went to go get on an elevator one day, or he's been out and about a little bit here and there and seeing, you know, people with no masks in his area down where he lives. You would think they'd be more conscious and aware, but it's like a millennial age thing. And no offense to anybody on the call, but that seems to be the aged group of people that I see on the news, or that I've seen in the couple of times I've gone to the grocery store or whatever, that are just running around, not paying any mind to anything, and not wearing a mask or keeping that distance or whatever. So how do we educate people? Even in the
Sometimes it's a matter of entitlement. It's not a matter of an age group or a generational gap. Even in our own building, there's a rule that says 2 people per elevator. We happen to live on the 6th floor. Coming down one day, the elevator stopped on the 4th floor, and the community service officer, who was a full-time Rockville police officer and lives in this building and feels entitled, wanted to get on with his dog. We said, would you mind waiting for the next car? We'll send it right back for you. And his comment, as he barged between the 2 of us with his pet with no mask, was, it's just an elevator. And of course we reported him, but
a very enclosed elevator.
It's a close elevator. It's a big building and the elevators are new, and so therefore they're relatively large, but still the rule is the rule, and the rule should apply to everyone, not only the people who are paying full rent, right?
Correct.
Yeah, so sometimes it's an air of entitlement. It's I'm better than you. It has nothing to do with generations, because some younger people I see are absolutely the most amazing contributors to the whole safety issue. They're doing a really, really good job. Did you and your group address recovery as well?
Well, that was one of the things in the recovery part is that we need to educate people to what the needs are, you know, what they need to be doing to be able to move forward in this new normal and stay safe and keep everyone around them healthy and safe. So that was one of them. As far as another step, as far as how long we thought it would take to recover, years. It's not going to be a quick recovery. It's not going to be, I mean, this may be the new normal forever. Who knows? We don't know. That's the whole frustrating part, is we don't know. We honestly don't know what is going to happen, what the new normal is really going to look like, how long it's going to last, if it'll ever go away. We just don't know. But as far as economy and stuff like that, it's going to take a few years probably to recover.
Okay. Does someone want to speak on behalf of Breakout Room 2?
Hello. For group 2, we were pretty much all on the same page as far as the greatest challenge. And like Jeannie was saying, all of us were saying the cleaning, the social distancing, and just, you know, getting back in the office and making sure those priorities are also kept up at that point as well. And as far as how long it would take to recover, we dealt with it like on a more personal level for each person, rather than talking about it as far as how long it would take for, you know, everyone to recover. And for us, it was, you know, not really too bad, because I think we basically just feel that, you know, we don't live far. We want to get back to work. We want to keep the social distancing thing in place, the cleanliness better, keeping that up, and being more stringent about that when we're especially out and about getting back to work. But we didn't really much talk about how long it would take. But I'm in agreement with Jeannie. I think it's going to take quite a long time for people to recover, unless there is a vaccine found, it may take years.
And then will everyone be compliant and be willing to get that vaccine?
Exactly.
No one really
And
knows.
if everybody isn't doing the same thing, I feel the same way. Like that elevator situation.
Yeah,
People are people. It doesn't matter where you are, what you're doing. Social distancing is going to be the best way to keep it not from spreading. And I completely agree with the mask, the washing, the cleaning. If everybody's not doing all of that, and everybody's staying the same distance apart from each other, respecting the distance, respecting the cleanliness, we're going to have another spike and a worse spread. I mean, they're already having it in China again. Listen to the news.
And you're concerned about your family, your kids, your future.
Mm-hmm.
You know, where will they be?
Yeah.
You have a new grandchild. What will that look like for that grandchild growing up?
Yeah. And will this always be her new normal?
Exactly. That's exactly right.
Some kids you're bringing, there's already been people, people are born every day. They're going to wake up to a society, be born in a society where this is all they've ever known.
Exactly. That's a very good point, Pam. Yeah.
So.
Okay. Thank you.
Stick with it.
How about group 3? Do we have someone who was in group 3?
That would be myself and Donna Hill. And we came up with pretty much the same points that everyone else made. I mean, we are concerned about how long this is going to last, whether or not it will ever end. And really our only action is to be patient and just kind of, wait and do our part. One of our second concerns is coming in contact with people, when we do our everyday things that we have to do, like grocery shopping.
Mm-hmm.
We're all touching the same products and picking things up and touching things. That's what we do. And whether or not we are touching items that have been in contact with someone that could have been infected, or even just being close or near someone that could have the virus, and we could be bringing that back home. Or if we go back to work, we could be bringing it to work and exposing our coworkers to it, and our coworkers going home and exposing their families. And some of us have family members that would be categorized as vulnerable.
Exactly.
Some of us have parents that we're taking care of that are not well, or who have weakened immune system. In Kim's case, Kim just has a new baby, a grandbaby. So, obviously with him being a baby, that's a concern. So just that is a major, major concern. And what do we do? What do we do about that? Because when we're at work, we have a common space. We have a refrigerator, we have a microwave, we're using those same items and we're touching it. Are we going to, practice on every time we use bases, wiping all surfaces down once we're done? So again, that could be like an action, wiping surfaces down, but after a while you may forget. I mean, we would have to literally retrain ourselves, because in a normal world, we are not wiping down toasters after every use, microwaves after every use, refrigerators, handle
to the coffee pot. Yeah.
Coffee pot. We're not doing that. So, we would have to really retrain our whole process as it relates to using common spaces. So, again, another concern is continuing relationships with our clients, our vendors, people that we work with outside the organization. How do we maintain a relationship with them? And I guess our action item is really to, continue with this virtual world that we've been living in now, and just kind of making more, contact in that way, because, kind of face-to-face interactions are now little to no. And
sometimes it's mask to mask.
Right, mass to mass. And so in my business, it's difficult because face-to-face interactions was really how, you know, we interacted in business development. This is what we did. It was business development is a social, position, and it is important to be in front of people all the time. And so now I've found myself emailing people more, a lot more phone calls than normal, and definitely more Zoom or video conferencing than I've ever done ever in life. So
Yeah.
that's really an action there, just to kind of, you know, continue to be more virtual and just kind of re-strategize as to how to best stay in front of people, because the days of pre-bid meetings and just outreach events are just gone.
Right. And then when you think about your own workforce, you also have a diverse age group. You might have very young people who are very technically competent and feel really familiar and are unafraid of devices and technology. And you might have people on the other end of the spectrum who are fine if they have a 10-year-old by their sides. But if they don't, they too could have challenges just with connectivity, just with staying in touch, just with being part of the process and feeling really engaged. You want people to still feel engaged, both within the workforce, within your own environment, but certainly with your outside clients as well. You want them to feel as if you're on the top, that you've got this down, you know where you're going, you're headed in the correct direction, that they are first and foremost your most important client, regardless of who they are, and that you're putting them first and taking every step possible to ensure that what you create for them is up to standard and above, and that you at the same time are so respectful of your own people that you're ensuring their health, safety, and well-being as well.
Yeah.
It's a challenge.
Yeah, it is. Those messages are easier to convey in person than they are actually by email.
Right.
But phone conversations are good as well.
And I think that what we're seeing, and perhaps you're seeing the same thing, is an increase in telephone calls. The phone no longer weighs a ton. People are willing to pick it up and make that call just to hear the human voice.
Yes.
Because how much do you communicate in terms of your smile and your feeling and what you're thinking today in an
I think
email,
that's better.
as opposed to hearing that live voice, hearing that interaction?
Yeah, and the video conferencing is really good as well, because I mean, it's just as good as being in person.
Yeah, being able to see other people is important, right?
Yes.
Yes.
Yeah, I would agree with you. Okay, let's go back to slide share, to screen share. So we left the discussion when we entered the breakout rooms, and you all introduced yourselves. You all know one another quite well. You identify and know your own roles, and you were prepared to respond to the two questions. I want to tell you that I'm overwhelmed with the amount of disclosure that you shared in terms of your own questions, your own responses, and how you're feeling now and what you think about what the future will hold. So I really want to thank those folks who were involved in rooms 1, 2, and 3, and the 3 of you who did share the results for your team. I know that they were collaborative approaches and that each of you shared your thoughts and had input into the total outcomes. So thank you very much for being willing to do that. We can now enter into a phase where, okay, we're welcome back from the breakouts. We shared what we knew. Let's look at comments and questions and anything else that you have to ask of me, and perhaps suggest how I might be able to add greater value to you. Any questions, any concerns?
Sharon, I think that, you know, as small as we are, we're going to phase people in to, you know, just have rotating shifts, you know, just to be on the safe side. Our office is small. The bulk of our offices are, there's only one person in them, but there are a couple of offices that I'm ordering plexi partitions. So when,
Right.
you know, I'm not sure that it will ever get to an office that's going to be like it was before, because we have to watch, you know, for safety reasons and everything. So, you know, but the partitions like they use when you go to pay for something at the grocery store, we're going to be putting those up between,
Right.
there's still a 6-foot space, but we're going to be taking that action. And we have an action plan that we're working on, ordering supplies. So, it hasn't always been easy to get the supplies that you want to get. So we are going to work very hard just to be prepared for that.
Mhm.
And also, have real conversations with people. Are they fearful working back and, in the office? Because a lot of people are.
Yeah. Do you see a lot of your people who will be more willing to perhaps work remotely from home in the future, Kim?
I do. I see some where it makes sense that they would want to work from home. The productivity, as long as the productivity is, the same as, is acceptable or better, we may go that way.
Yeah. And sometimes I find that people are thinking that the productivity is at a higher level.
Mm-hmm.
Engagement might be a little less, but the productivity is higher because they're focused and didn't have to spend time traveling to get where they're going.
Yes.
And worrying about the traffic and the problems along the way, especially if they were using public transportation. So if they have that option to do so, there you go, Pam. I think that people are really perhaps more willing and feel safer if they're at home.
If I may, public transportation for me is not bad, but at this current time, there's actually some that is not even running local transportation.
So
So, it's a little
availability is
bit,
a big issue.
yeah, it just had to rework the route a little bit, but some of the buses they took them completely out of service 2 months ago.
Mm-hmm.
Yeah.
But
And then when they're back in service, how safe will it be to be on that bus in close
and will they
proximity to
continue
someone
to keep them
else?
clean? That's the
Yeah.
problem.
Exactly. I had this discussion with the airlines the other day. I'm seeing a lot of my peers are saying, well, they're traveling Southwest and they're traveling Delta because they're maintaining a 50% overall capacity. And that's fine. 50% you can deal with. But I like to fly American. I have flown them ever since they started. It's, I was living in Texas at the time. It seemed appropriate. They went everywhere I wanted to go. And they told me that they're working at 70 to 80%, but their option is that if you get to the airport and it looks as if too many people are on your flight, you have the option at no extra cost to get off that plane and wait for the next one. But what's to prevent the next one from having the same number of people? Do you decide to spend the whole day at the airport and not go anywhere just because you're waiting for a flight that doesn't have perhaps too many people? So what I see a lot of people doing is scheduling departure times if they need to fly at 12 noon or at 1 p.m. or at 11 a.m. at off times when other people would be working and perhaps are not, having heavy loads of travelers, because I think that that's probably safer. The same thing for returns. They're not taking that 8 o'clock in the morning flight or that 7 a.m. in the morning flight that's going to get them to a meeting in the next city at 9. And instead they're choosing to go during off hours. So I think we'll see perhaps a lot of changes in terms of what are normal business hours. When are we open and what days of the week are we open? And can we perhaps work different shifts and different times and still reach the same level of engagement or higher, but also reach the same business goals for what we need to produce and what our outcomes need to be. They're all concerns. So I want to thank you for being with me today. It's really been a pleasure. It's always a joy to work with my friends at D2. It's nice to see so many familiar faces and then also to see the palm tree in the ocean. They're not in my near future, but you never know. We never know. It could be 2 years down the road or even longer before we get to see a beach or feel that sand or feel the same things that we were feeling before. The
To the
important
beach 2
thing
weeks
is
ago.
that it's new,
Yeah.
it's next, and it can be forever. And none of us can foresee what that might look like. We need to be patient. We need to care about those around us. We need to be kind. We need to have a positive attitude and really think and know and realize that this is for our protection as well as the protection of our future. Thanks again for joining me today.
Thank you.
Sharon.
My pleasure. Thank you so much.
Very meaningful conversation. Thank you very much.
Thank you. I'm going to stop the recording now.